Tonight, Ontario reassuring parents schools will be safe when kids return to classrooms on Monday.
Staff and students will receive 2 tests each as an initial supply.
The province also saying schools won't be reporting positive COVID cases, but instead monitor absenteeism, with the health unit notified only when 30% of students and staff are absent.
To me, that makes sense, to be honest.
I mean, I wouldn't understand why they'd do that.
Some parents okay with the new policy, others feeling less than confident sending their kids back to school in less than a week. And
saying something's incidental, we have to just be, I'm not saying throw out the concept entirely, just be very careful at how you look at it.
Ontario also making changes to the way it reports hospitalizations, distinguishing between those admitted to hospital because of COVID and those who tested positive after being admitted for other reasons. Good evening, I'm Kelda Yoon. With students set to return to school on Monday, the province is reassuring the public today its classrooms are safe. As students and staff will each get 2 COVID-19 rapid tests to use. The education minister is saying it's just one of the steps being taken to keep everyone safe. But there are concerns tonight about new protocols around tracking and reporting COVID-19 in schools. Ali Chiasson has those details.
As much as the province said they are doing in providing PPE and rapid tests,
staff and students will receive 2 tests each as an initial supply, with over 3.9 million rapid tests shipped to schools as we speak, ready for January 17th.
One thing they are not budging on is reporting COVID case counts at schools. Instead, schools will report absences. You won't know how many are due to a COVID outbreak. No longer necessary, officials say, because parents can use rapid tests and rely on screening measures.
We've also created a more stricter screening protocol for students and staff before they enter schools to help prevent any cases from getting there in the first place.
Because I have a small baby at home, I just feel afraid of, what he could bring back into the house.
Whether parents feel the schools themselves are safe or they're sufficiently equipped with masks and tests, it's the lack of transparency around school cases that's unsettling for a lot of parents, like Savannah Downs, whose eldest son just got over his COVID-19 infection.
It feels so risky that I don't feel comfortable sending him on Monday because I don't know what I'm sending him into.
But schools are not to be feared, according to the Chief Medical Officer of Health.
Schools will reflect what's going on in the community. Schools are not and have not been shown to be a significant multiplier of risk.
When 30% of staff and students at a particular school is absent, parents will be notified, and a network of teachers in training and retired teachers will be called to step in. We found one of them waiting in line to try to get a box of rapid tests ahead of Monday.
I'm one of the retired teachers who's been helping out both last year and this year. I taught almost every day last year.
She's one of the many people feeling reluctantly ready to be back in class on Monday.
I think that the rapid test may not be perfect, but it's one of our arsenal to protect ourselves and our community.
Ali Chiasson, CBC News, Toronto.
Now, regarding absentee rates in schools, the government clarified tonight that parents can find the latest numbers specific to their kids' schools on ontario.ca starting on January 24th. But again, those are absentee rates and not COVID positive cases. And meanwhile, more parents, educators, as well as the opposition are reacting tonight to the new policy and the government's plan for a safe return to school. Ardell Manukduk has more.
Instead of the saying, what doesn't kill you makes you stronger, what some heard today was what you don't know won't hurt you.
I don't know what the 30% is supposed to provide in terms of an understanding for parents to act or not act.
The province's decision to cease reporting positive infections in schools, drawing mixed reaction from parents at this East Toronto park who overwhelmingly want their kids back in school.
We're treating this disease differently from other diseases, and we've never recorded kept testing kids for flu or any other thing.
Without more information, it's hard to interpret. I mean, I wouldn't understand why they'd do that.
So parents won't know if there's COVID-19 in their child's classroom for sure. And with just 5 days until in-person learning resumes, there's plenty more questions left to be answered.
What is the criteria for closing down a school, closing down a program? What is the school board going to do to mitigate what will inevitably be increased absenteeism due to the Omicron variant.
If I was a parent right now, I'd be wondering why the government's position for rapid tests is, well, we're going to wait till your kids are sick, and then once your kids are sick, you can give them this rapid test to confirm that in fact it is COVID.
Meanwhile, Ontario's top physician was asked today about making vaccines mandatory in schools.
So it is a new vaccine, and as a result of that, we want a greater experience with it before we'd ever mandate it.
That didn't sit well with a lot of people.
He has a fundamental responsibility to be encouraging people on the uptake of the vaccine across the board, and not feed into the vaccine hesitancy and the lack of confidence that some people sadly still have.
In a statement issued later, Dr. Moore writes, "I want to be clear that the pediatric Pfizer vaccine for children 5 to 11 is safe, effective, and provides strong protection against COVID-19 and variants." He goes on to encourage all children 5 to 11 to get the vaccine as soon as possible. Dale Manukduk, CBC News, Toronto.
Ontario is also making changes to the way it reports hospitalizations. The province is now distinguishing between those who are admitted to hospital for COVID-19 and those who go in for another reason and then test positive, also known as incidental admissions. But what exactly do those numbers mean? Lisa Shing takes a closer look.
As hospitals deal with the largest wave yet, the province has started reporting the numbers with a new breakdown. Of today's reported 3,400 patients in hospital with COVID-19, 54% went in for COVID-19. The other 46% were incidental, admitted for other reasons, then tested positive upon arrival.
Just be very careful at how you look at it.
This infectious diseases doctor says that incidental number, while high, isn't specific enough because it includes both people who have COVID but are there for unrelated reasons and.
We shouldn't fail to recognize that there is a population of patients who do not require any COVID-specific therapy, but are in hospital because COVID has exacerbated some chronic illness. One area that is hard to define, but is no doubt occurring.
Sometimes you wonder, well, what caused their fall? Were they weak that they caused their fall, and were they weak because they had COVID?
This ER doctor says COVID could keep these patients in hospital longer.
There are some cases and where having COVID in addition to what they're actually admitted for can make things more complicating, can make them longer to recover.
And those incidental COVID cases are also a big strain on the hospital system.
It has a lot of consequence for us. We have to worry about infection control. We have to worry about where we're placing these patients. Are they exposing staff? Are they exposing other patients? And we have to watch for the COVID to potentially become a driving force.
Doctors say this wave hasn't crested yet, though the numbers are clear about one thing. COVID-19 is now everywhere, affecting everyone. Lisa Shing, CBC News, Toronto.
One person has died after a two-car collision in Vaughan tonight. Police say the two cars crashed head-on.
It appears that one vehicle was eastbound and one was westbound when one of the vehicles crossed the center line and collided with the other vehicle.
It happened on Teston Road between Weston Road and Pine Valley Drive shortly after 5 o'clock tonight. One of the drivers died of their injuries on the way to hospital. The other was not seriously injured and was released from the scene. Now, there's no word on what caused the collision. Now, that section of Teston Road is closed for the investigation. Anyone who witnessed a crash or has dashcam video is asked to contact police. Colette Kennedy joins us now with a first look at the forecast. And Colette, quite the difference from yesterday. Temperatures much more bearable.
Thanks, Kelda. Well, boy, what a change we've had between the cold temperatures yesterday morning, -21, and then today making it above freezing. So daytime highs, if we have a look at those today across the region, you see lots of mild conditions at freezing or above. Do you notice an exception there? -7, that warmer air just not quite making its way to the nation's capital. Well, we do have a weak system that's moving through tonight, so a little bit of that kind of light mix through the Niagara region, but we'll see this pushing through the GTA in the overnight hours. Could be just a little bit slick. This is light stuff, but still on the roads for tomorrow morning. And then as we get into the afternoon hours, late evening, we get a little bit more. So all told, it's not going to amount to much, less than a few centimeters, but still it will make things just a little trickier on our roadways. As for your temperature tonight, hey, it's still mild low, -3, and tomorrow up to 1 degree. Now, Kelda, I have to tell you that there's a lot to talk about in the long range. Some colder air that's going to be coming back at us, but also the risk for some snow just as the kids are heading back to school, all that coming up.
All right, talk to you in a bit. Thanks so much, Colette. Even before the pandemic, many communities have been dealing with a shortage of family doctors, and that's backed by data from the Canadian Medical Association, which estimates about 5 million Canadians don't have a primary care provider. But in some places, like Kingston, Ontario, the regulations in place have only contributed to the problem. Michelle Allen looks at how that's affecting access to healthcare.
Mark Richardson and his husband have been on the waitlist for a family doctor since 2019. The couple has reached out to over a dozen clinics in Kingston with no luck. Richardson is dealing with a recurring abdominal pain, but without a family doctor,
I'm hoping that it's just nothing and it's nothing permanent, but I mean, it could be.
His troubles are not unique. Nearly 30,000 patients currently don't have a family doctor in the Kingston area. CBC News analyzed data on all the physicians licensed to practice family medicine in Kingston. Out of the 125 doctors who were verifiably active in family medicine, 81% said they're not taking new patients. The remaining 19% who are only accepting certain kinds: newborns, military personnel, post-secondary students. And none told CBC News they're accepting new patients from the general public. One of the reasons why Kingston is so short of doctors? Provincial regulation, which limits how many family doctors are allowed to open a new practice. Right now, Kingston has reached its cap. Anyone who wants to open a new family practice would have to agree to bill per service, rather than bill per patient. A major disincentive, according to critics.
Restricting where people go to work is not a helpful policy solution.
Dr. Michael Green teaches public health sciences at Queen's University. He says doctors who get paid per service make less money, work more, and have less support. So they go elsewhere, and patients pay the price.
It encourages the kind of practice that's not really helpful for the chronic diseases that we're managing today and for supporting people who have multiple problems or mental health issues, because they're very encounter-based. They encourage short, frequent visits.
There are exceptions, but only if your community makes it to Ontario's so-called list of areas of high physician need. Cities like Toronto and Ottawa are on the list, meaning they don't have to adhere to the same regulations, but not Kingston.
I've tried advocating for my own health through the clinics I've called and friends of friends and connections you make, but it seems like the biggest barrier is something I don't have any control of, and that's just the number of doctors in the area.
The city, meanwhile, is taking matters into its own hands, offering a bonus of $100,000 to any family doctor who sets up a rostered practice for at least 5 years. Michelle Allen, CBC News, Kingston.
A new vaccine mandate goes into effect for cross-border truck drivers on Friday. All drivers crossing into Canada will have to show proof of vaccination or face a 14-day quarantine. As Greg Ross explains, the new rule could mean the loss of work for thousands of truck drivers and major delays in the supply chain.
The drivers will have a very difficult decision to make.
Marco Beghetto with the Canadian Trucking Alliance wouldn't say his organization supports a federal vaccine mandate on truck drivers, but did say this.
We support vaccination and promotion of vaccination across the industry.
He says between 80 and 85% of their drivers in Canada have been vaccinated, but still they have thousands who will be impacted by the mandate, which goes into effect on Friday.
We're looking at about 10 to 15,000 drivers. They have a reality they face, not a typical of what the average Canadian worker is facing at their workplaces as well.
Many simply won't be able to work if they can't cross the border, which could put them out of a job. With fewer drivers on the road, we could be facing major delays in the supply chain.
We've been working very, very hard to ensure that supply chains continue to flow. What is top of priority for all of us, of course, is making sure that the health and safety of Canadians are looked after, and that is what vaccines are about.
On Friday, drivers will be expected to use the ArriveCan Border app to show proof of vaccination, something that may be new to many drivers, which is why the Trucking Alliance is asking Canada Border Services for a grace period to adjust.
On a short-term basis, we're asking for redundancies and other alternative mechanisms to mitigate the impact.
The Trucking Alliance is asking that all of their drivers carry a paper copy of their vaccination records when they cross the border. Greg Ross, CBC News, Toronto.
Welcome back. We're getting more reaction today to Quebec's plan to tax unvaccinated residents. Now, here in Ontario, officials are confirming today the province has no plans to follow suit. Talia Ricci has the latest.
A word used on more than one occasion today as many reacted to Quebec's proposed tax, punitive.
My perspective is actually very simple, and that is that we don't punish in our universal system people who make poor choices.
It's a move Ontario officials confirmed would not be making its way here. Today, Toronto's mayor, Ontario's premier, and top doctor said they believe vaccine mandates, education, and making vaccines accessible are more appropriate tools.
We aren't going down that road. We're going to take a different approach, but I implore, I ask, I beg every single person that's not vaccinated, please protect yourself, protect your family, protect co-workers. Please get your vaccination.
What do you do about people who smoke and who end up in the healthcare system? People who have substance use issues who end up in the healthcare system. And so it's just a road that I think we best not go down at the moment here.
Quebec's premier said Tuesday the province will impose a health tax on Quebecers who refuse to get their first dose of a COVID-19 vaccine, and that he wants the cost to be significant. Roughly 10% of eligible Quebecers remain unvaccinated, but health officials say they take up about 50% of COVID-19 beds in hospitals.
I think having more stories that the fact that the intensive care units really are pretty much filled with unvaccinated populations, getting those stories out, getting stories out about how vaccination has actually saved lives in families.
Privacy is on the mind of this bioethics professor.
Would it be Revenue Quebec, Revenue Canada? Would it be, the Quebec Police Force? If there's any third party that's responsible for these fines, you then have healthcare information without consent moving to third parties.
One doctor who works with vaccine-hesitant populations says it's not fair to paint people with the same brush, noting for some, this proposal could further erode trust in the government.
Not to label the group as anti-vaxxers, but rather to try to understand the different experiences, lived experiences that each person within that group comes with. And many people, they have that mistrust and distrust of the government and healthcare system because of different experiences that they have encountered.
Even though Ontario officials dismiss the idea, it still doesn't sit well with this professor in a national context.
It sounds patriotic, but very un-Canadian. In this country and the Canada Health Act, we don't make judgments about our patients. And I think it really crosses that line. I think it really tears at the very roots of how we perceive the ethics of healthcare in this country.
Talia Ricci, CBC News, Toronto.
You're looking at a live shot of the Toronto skyline, cloudy with clear breaks this evening. A few flurries in some areas. Temperatures milder than last night, currently sitting just above freezing at 1 degree. Let's go back to Colette now with a look at your extended forecast. And Colette, lots going on, from cold temperatures coming back and snow.
Hey, Kelda. Oh, my goodness. We have so much to talk about. So many changes we're going to be seeing in the weather over the next few days. So let's get to it and have a look at these weather headlines. A light dusting on the way. Yeah, just that. A few centimeters or less. I'll show you exactly where and when. And then the cold air will be back. So we have one more day where temperatures are above seasonal, and then bitter cold air comes back in Friday into the weekend. And there is a chance to get into some measurable snow Sunday night into Monday. So I want to show you that as well. But just have a look at how these overnight temperatures are going to be changing. We're looking tomorrow morning at mild conditions. That's why it'll be kind of wet flurries or even a mix, especially in the Niagara region. But as we get into Friday morning, we're talking minus teens, and we may warm up a little bit from there. Our daytime high, I've taken it up a bit, but then the temperature falling through the afternoon so that by the time we get to Saturday morning, yeah, the minus 20s. return, and the wind chill probably making it feel closer to -30. So this weak system pushing through, a little bit of mixed stuff still are already through the St. Catharines area and for you there, but it's going to be coming through even tomorrow morning, that chance for the morning commute, a break, and then into the afternoon. So we're looking at, in general, kind of a dusting with the higher amounts, and they're not even high to the north and to the east, but we will get into some clearing. So although we're going to have to accept that cold weather coming back, we'll at least get it with some sunshine by Friday. So Thursday, there's a look. See where I'm saying just a few centimeters likely. It does get a little heavier over towards Kingston and towards Brockville and Cornwall and through that region. Overnight tonight, a little bit of that mixed stuff from earlier really tapering off. You get out of the system a little earlier, but some fog in the morning, and then still those mild temperatures into the afternoon, 2 degrees for your high, Windsor. And tonight around the Golden Horseshoe, a little cooler towards Markham with a little bit clearer conditions, but we will see this system making things a little slick on those roadways. And then having a look what's happening Friday with that -10 for the high, then that temperature falling off, bottoming out for Saturday morning. What a way to go into the weekend, and what a way to come out of it Sunday into Monday. Not a complete agreement yet on the tracking of this system, but Kelda, we could be talking about 5 to 10 centimeters, in some cases even more than that. Yes, we'll talk more about that as it gets closer.
Thanks so much, Colette. Finally tonight, without fans in the stands, the Toronto Raptors had to rely on someone else to distract the opposing team.
His first free throw attempt, you see the Raptors mascot. You know, when there's nobody else in the building, you kind of stand out.
All right, keep an eye on the Raptor, Toronto's mascot, doing a one-dino distraction maneuver, much to the chagrin of Phoenix Suns star Devin Booker. And normally dozens of fans would be trying to throw that free throw off, but the Raptors are playing home games in an empty Scotiabank Arena because of COVID-19 concerns, and the mascot's got to pick up the slack. Booker asked referees to move the Raptor between shots. The Suns went on to beat Toronto 99-95. But there's no bad blood between Booker and the iconic mascot. Booker says they hashed it out after the game and everything is cool. And that's our show for you tonight. Thank you so much for watching. Dwight Drummond has your next local newscast tomorrow at 6. I will see you back here tomorrow night at 11. Have a great night.